CEO of UICC, and it's a great pleasure today to talk to Teresa Graham from Roche, a friend of UICC for a number of years. Teresa, how are you doing? How's Roche at the moment in sunny Switzerland?
Yeah, we're doing well. Fortunately, the heat of the summer has passed us by, and we're beginning a beautiful fall. So it's a great time to be here.
Well, same in Geneva, actually. It's sunny today, but a bit chilly. But anyway, let's move on to the subject of our discussion today, which is covering a whole host of things to do with access to medicines and the future of cancer care. I know that you're a passionate individual when it comes to looking for breakthroughs and how those breakthroughs can make a difference around the world to cancer patients. And you've been working in oncology many years. So what excites you at the moment about the future of oncology compared to, say, the past? What do you think is happening now which really excites you?
Yeah, not that many years, Cary, just to be clear, but a reasonable number of years.
4 years. We'll say 4 years.
Exactly. But you're right. I'm so excited about where we're at right now. I mean, I think over the last couple of decades, we have made such significant progress in oncology care. And while we still have a long way to go to make oncology a curable disease, I can think of at least 3 places that I'm really frankly passionate about, as you mentioned. So first, I think we're just learning more and more about the biology of cancer every day. We know that every cancer is unique, and that knowledge is foundational to driving further progress, because it's only with that deep understanding of science that we'll really be able to move things forward. That, combined with data analytics and advanced technology, it just allows us to take a really different look about cancer at every stage, from keeping people well to detecting and diagnosing early cancer to providing the right medicines at the right time. Secondly, in order to truly maximize success as we're striving to find cures for cancer, we need to shift diagnosis and treatment to much earlier stages of the disease. This is where the chance for cure is the highest. Beyond treatment options, we've had major progress in cancer care in terms of screening, early detection, patient identification, and selection, particularly in the early disease setting. And those advances continue at pace. And finally, this idea of the promise of science, right? We've witnessed how cancer immunotherapy has really turned the tide on so many cancer types, and there's much more to explore. But beyond that, we have gene therapies, cell therapies, cancer vaccines, all of which are on the cusp of our scientific understanding right now, but are likely to become much more important treatment approaches in the next couple of years. And I think if there's one place that really exemplifies the progress that we've made, it's lung cancer. Lung cancer in the past, a patient primarily would have been diagnosed metastatic, very, very relatively advanced. They're eligible, they would have had surgery, often received chemotherapy, which might have had limited efficacy and often came with challenging side effects. But today, we now understand lung cancer much better, and we know that patients should be tested to see if there's a genetic driver of their disease, which can lead to a much more targeted therapy. Depending on that outcome, you can have any variety of treatment options that you can go to, and that outcome for a patient today, we know will vary on the type of disease that they have, but we're seeing such more encouraging results. And then that promise of advanced diagnostics, artificial intelligence, and other interventions that mean that we can potentially diagnose a cancer patient so much earlier than we could in the past. Maybe even with a simple blood test to sort of determine if there's circulating free DNA. So I think there's still a long way to go. We're still at the beginning part of this journey, but we know so much more than we did before. We know more about how to bring it to the forefront for patients. And there's certainly a lot more hope today than there was yesterday.
I cannot agree with you. I sort of feel that we're in a period of where there will be massive change. And in UICC, we've occasionally called this, it will be the decade of the diagnostics, because we're making so many advances in terms of being able to identify cancers earlier through new ways of diagnosing that cancer. It's just extraordinary. You mentioned lung cancer, and I was at a meeting last week where we were discussing progress in cancer treatment and care. And it was pointed out that in some of the cancers, we've made no progress at all in terms of survival rates over 5 years. Like of pancreatic cancer, liver cancer, and actually lung cancer came up as well. What are your thoughts about the advances? Do you think that will be probably for the first time that we can make a material difference in survival rates for those particular cancers? Is that an opportunity that we have?
I sincerely hope so. Whether it's, understanding better about how to combine the treatments that we have today, or we're finding new treatments tomorrow. And I think we really are starting to look at some of these cancers that have historically been much, much more difficult to actually impact. And as we understand the biology better, we will have a better chance to actually bring the kind of advances that we've seen for breast cancer, for some of our hematological cancers, for lung cancer, to things like pancreatic cancer, where we've just had a much lower success rate.
Well, I'm hopeful that we can do that. Of course, one of the biggest challenges we face, and I know you're passionate about cancer patients, UIC is passionate about cancer patients, is that 70% of new cancer patients are going to be in low middle income countries in the next 10, 20 years. 70% of deaths occur through cancer in those countries. And yet those are the countries which have the least available essential medicines from the WHO list. Radiotherapy is short in supply. Trained oncologists short in supply. So if we're really committed to addressing the challenge of getting medicines to cancer patients around the world, then how do we do that? What are the ways in which we can bring those innovations to where the market, I guess, from a private sector view is, or where the problem is from a global health perspective is? What can we do?
Yeah, I think this is such an important question, Cary, and I think systemically we face a number of challenges that hinder how quickly we can bring innovations to patients around the world. This includes gaps in comprehensive universal health coverage, which is really fundamental to addressing some of this inequality in access in healthcare, particularly in LMICs. But there's the fragmentation and inconsistency in regulatory and reimbursement processes, capacity and shortage of trained healthcare professionals, weak healthcare infrastructure, geographic barriers. I mean, there are so many things that prevent us from actually being able to make progress for patients. Patients themselves face numerous challenges during their journey. Some of these challenges, the physical, mental, social, financial hurdles, they can be addressed, but they sort of need comprehensive partnerships in order to make that happen. And I think, as a company like Roche that operates in so many different places around the world, I think what we recognize is that while there may be commonalities in some of these challenges, that one size fits all approach just doesn't work. We need to work on a global, national, and local level to identify those root causes and barriers and areas where we can catalyze change. And at the core of this is really listening to, understanding, and working with patients, healthcare professionals, policymakers in these individual localities and countries to ensure that every solution that we're bringing addresses the actual reality on the ground and brings meaningful and lasting change to those patients. And frankly, this is just something we can't do individually. This is something we absolutely need partnerships with, or partnerships to make happen. And so I'm actually really curious to ask you a question, Cary. We certainly see partnerships as being pivotal to bringing access to medicines and diagnostics. What role do you and UICC see in bringing that innovation, in partnerships' role in that?
Well, I think our start point is that this is a very complex problem, and you've beautifully articulated all the challenges involved in getting a single medicine to a single patient. It's a complicated challenge. And I said something in a meeting the other week, which was tweeted, which was, to every complex problem, there's a simple solution proposed by an idiot. Okay. And I really believe that the solution to these complex problems is actually complexity in partnerships. Yeah. We have to get the right people around the table with all of the component skill sets, experiences, and knowledge, and see how we can amplify that, working collectively on target countries and populations where we can collectively make a long-term sustainable impact. A lot of the solutions we see in access at the moment through great organizations tend to be quite vertical, with a single company, single organization, and a few countries. That's not going to solve the 70% problem, which I outlined earlier. So earlier this year in May, at the World Health Assembly, we launched the Atom Coalition, and Roche is a partner to that, as are many, many other organizations. And what's been interesting to me is that without really too much convincing, everyone we've spoken to said, like, you're doing a great job. Why don't we do it together? And you amplify what you're doing and work with others that can find solutions to the problems that you find with your medicine or with the work that you're doing in country. And I think that's the best way forward. And that's come out of many years of us all recognizing that partnerships are the best way to go ahead. And I'll extend it beyond medicines. I think it includes radiotherapy, surgery, training of oncology professionals, pathologists, diagnostics. You know, the stories that I heard when we were forming the coalition was about, well, there's no point putting the pathology in there and diagnostics because we don't know what medicines are going to come in. And likewise, we're not going to have medicine, there's no diagnostic pathology. And you go around in a loop, a systemic loop, where we have to come in and say, well, I'm going to put it all in, and it'll be in a sequence, hopefully, which allows us all to say, that's been solved, tick, let's move on to the next challenge that we have, but let's solve that problem. So I see partnerships as the only way that we can solve this. It's not going to be Roche, and it's not going to be UICC, it's not going to be NCCN, ASCO, it's not going to be ASCP. It collectively, though, what a powerful unit with a fantastic CV, which can then approach countries and say, we can work with your experts, because there are lots of experts on the ground, to help you resolve the challenges that we perceive you have, but also the ones that you say that you want to resolve. So partnerships to me are the very essence of how we face that complicated, complex challenge about access in low and middle income countries. And our partnership is one example of helping to bring that together. So very, very important to me.
Yeah, I completely agree with everything that you've just said. I mean, the value of partnerships just can't be overstated. And honestly, I think we saw that in living color through the COVID-19 pandemic. We can move faster than we ever thought possible when we work together. And I think, you know, what I've always really valued about Roche is sort of the ability to develop long-term sustainable partnerships that address local health needs, working with governments, patient groups, and a range of other organizations to tackle these local challenges. And it can be done, right? I mean, we've got a great example in Nigeria where Roche led a private sector coalition alongside the cooperation of the World Bank IFC that resulted in the establishment of the 2021 Nigerian Cancer Health Fund for the standard of care cancer treatments. That's currently being piloted in a number of centers, I think 6 around the country, providing access to funding for medication, chemotherapy, radiation services for people with really prevalent cancers, breast, cervical, prostate. And this is something that's extensible. You can actually, you know, do it in more places once you kind of see how it works. And I think things like that are why we're so excited to be a part of the ATOM Coalition and why we work so closely with UICC, because we just really do firmly believe that there are solutions to these challenges if we can really work together to make a difference. And so you are one of the partnerships that we value the most, because we really do think that working together, we have an actual chance to make a difference.
Well, we really appreciate that. And I know everyone I've ever met in industry, the NGO, WHO, government, local UIC members, we all want the same thing. We want to save lives.
Absolutely.
Now, with that common ambition, we should be able to resolve the majority of the problems that people are facing. So anyway, Teresa, it's always great to talk to you. Inspirational. Thank you very much. Hopefully see you at the World Cancer Congress very soon. And if you're ever in Geneva, please pass by the UIC offices, and I'm more than happy to share time with you.
That would be awesome. We'll see you there.
Cheers then. Bye-bye.
Cheers.